Right now, take off one sock, just one. Look at the skin where the elastic sat all day. If you can see a clear indentation pressed into your calf, a groove that stays there for 30 seconds, a minute, sometimes longer before the skin finally smooths back out, I need you to keep watching. Because what you are looking at is not a sock problem. It is not a salt problem. And despite what almost every person over 60 has been told, in the majority of cases, it is not a heart problem either. It is a drainage problem. And the organ responsible is the one nobody ever bothered to explain to you. The fluid is already in your leg right now, pooled quietly in the tissues around your ankle and calf while you sat today. And tonight, when you lie down, that fluid is going to shift into your bloodstream, flood your kidneys, and wake you up at 2 in the morning, and again at 4, while you lie there exhausted, wondering why your body won't just let you sleep. I'm going to show you exactly what is happening inside that ankle and the 5-minute habit that drains it before bed so it stops running your nights. I'm Dr. Sarah Ellison, and I've spent over a decade as a practicing cardiologist helping men and women over 60 understand what their body is actually telling them, not just what is easiest to prescribe. In that decade, I have ordered more echocardiograms on patients with swollen ankles than I can count. Normal hearts, normal ejection fractions, patients who were still swelling, still exhausted, still being handed water pills that weren't touching the real problem. Today, I'm going to show you exactly what is causing your ankles to swell by evening, why the treatments most of you have already tried don't reach the actual cause, and a specific 5-minute daily habit that works with your body's real drainage system, not around it. If you haven't subscribed yet, please do that now. Every person who joins this channel makes it more likely that the next person who needs this information actually finds it. So let me start with something most people were never taught, even though it changes everything about how you understand swelling. Your body has 2 separate fluid networks, not 1, 2. The first one you already know, your blood. Arteries carry fresh blood out from the heart, veins carry used blood back. That system has a dedicated pump, your heart, running automatically every second of your life, whether you help it or not. The second network is called the lymphatic system, and here is what nobody explained to you. It has no pump, none, 0. Throughout the day, a clear fluid called lymph constantly leaks out of your tiny blood vessels into the spaces between your cells. It picks up cellular waste, dead bacteria, excess protein, and excess water. Then it has to be returned to your bloodstream through a completely separate set of vessels, around 2 liters of it every single day. But those lymph vessels have no heart attached to them. No automatic pressure, no pump. They move only when you move. Think of your lymphatic system as a conveyor belt that only runs when you step on it. Every step you take, every contraction of your calf muscle, every flex of your ankle physically squeezes the lymph vessels and pushes fluid upward. The moment you stop moving, the belt stops. Sit still for 3 hours, and the fluid simply pulls in your ankles, a teaspoon at a time, with nowhere to go. When you were 30, this wasn't a serious problem. Your lymph vessels were elastic. The tiny one-way valves inside them snapped shut firmly after each wave of fluid passed through. A short walk restarted the whole system within minutes. But after 60, 3 things change at once. The lymph vessels stiffen, the valves weaken and begin to leak backward instead of closing firmly, and the connective tissue around the ankles loses its own firmness. Fluid leaks out faster. The system drains it slower. The math stops working. And the reservoir in your ankles grows day after day. This is exactly why a diuretic, a water pill, does almost nothing for this kind of swelling. A diuretic tells your kidneys to pull more water out of your blood and send it to the bladder. But the fluid sitting in your ankle tissue is not in your bloodstream. It is in the spaces between your cells, in the soft tissue, the fascia, the connective layers beneath the skin. Your kidneys cannot reach it there. The pill drains your blood, your ankle stays swollen, and you end up dehydrated on top of it. You were not treating the wrong disease. You were treating the wrong compartment entirely. Let me tell you about a patient I'll call Margaret. Margaret was 69, a retired school teacher. She had spent 2 years quietly convinced her heart was failing. Her swelling had started gradually, just a little extra puffiness around the ankles by evening. Then it progressed. She could no longer fit into the shoes she had worn for years. She bought wider shoes. The swelling kept coming. Her socks left grooves in her calves that were still visible an hour after she took them off. An echocardiogram was ordered. The results came back completely normal. Ejection fraction of 62%, a textbook healthy heart. But Margaret was still swelling, so she was given a diuretic. She took it for 6 months. She ran to the bathroom constantly. She felt dehydrated and exhausted. And when she pressed her thumb above her ankle bone at the end of each day, the crater was still there. She sat across from me and said something I now recognize as the single most important diagnostic clue in cases like hers. The strange thing, Dr. Ellison, is that when I travel and walk around sightseeing all day, my ankles actually look almost normal. But the moment I'm home, sitting at my desk or watching television, they blow right back up. That was the clue that unlocked everything. Her swelling improved with movement, worsened with stillness. Her heart was fine. Her kidneys were fine. What Margaret had was a lymphatic drainage problem, and no pill in the world could fix it because the fluid was not in her bloodstream. It was sitting in her tissue, waiting for the one thing that could move it. If that sounds familiar, the normal heart tests, the water pills that didn't work, the swelling that keeps coming back every single evening, then what I'm about to show you is exactly what changed everything for Margaret. Before I go any further, I need to stop and draw a clear line, because there are situations where ankle swelling is not a lymph problem and is a genuine medical emergency. I need you to recognize these. If one leg swells suddenly and significantly more than the other within a few hours, and that leg is painful, warm to the touch, and visibly red, stop this video and see a doctor today. That pattern is a classic presentation of deep vein thrombosis, a blood clot. This is serious. And importantly, do not massage that leg. The massage technique I'll describe later in this video can be dangerous if a clot is present. If your swelling comes with shortness of breath, especially shortness of breath that gets worse when you lie flat, or if you wake at night feeling unable to breathe in a flat position, that points toward cardiac insufficiency, not a lymph issue. That requires medical evaluation, not a home protocol. If your swelling appeared alongside rapid unexplained weight gain, 4 or 5 pounds in a single week, combined with urine that appears foamy or cloudy, that combination can indicate the kidneys are losing protein. That needs blood work this week. And if you have one-sided, painless, firm swelling and a history of cancer treatment in that region, that needs proper medical evaluation before anything else. If none of those describe you, if your swelling is in both legs, gradual, worse by evening, better by morning, and you have no breathing trouble at rest, then this protocol is for you. Keep watching. I want to give you 2 quick tests you can do in the next 60 seconds, the same assessments I use clinically, so you have a real baseline to measure your progress against in 2 weeks. Test 1 is the pit test. Find the bony ridge along the front of your shin, about 4 inches above your ankle. Press your thumb firmly and hold for 15 full seconds. Then lift and look immediately. If the skin springs back right away, your drainage is relatively healthy. A slight dent that takes 5 to 10 seconds to smooth out is grade 1 pitting edema. A deeper dent lasting 20 to 30 seconds is grade 2. A clearly visible crater lasting over a minute is grade 3. Write your grade down. You will come back to this in 2 weeks. Test 2 is the stemmer sign. Try to pinch the skin on the top of your foot, just behind your second toe, between your thumb and forefinger. Try to lift it into a small fold. If you can lift a fold easily, your lymph is moving reasonably well. If the skin feels fused to the foot beneath, thick, impossible to lift, that is a positive stemmer sign, one of the most reliable clinical indicators of chronic lymph congestion there is. Note both results. In 2 weeks, you will retest. For most people who follow this protocol consistently, the change in both tests is not subtle. Before I give you the protocol, I want to walk you through 3 things most people over 60 do every single day that actively work against their lymphatic drainage. Because no 5-minute habit will perform the way it should if you are constantly refilling the reservoir at the same time. The first is hidden sodium. When most people hear cut salt, they think of the salt shaker on the dinner table. That shaker is almost never the real problem. The sodium-driving tissue swelling in older adults is hidden inside foods that don't even taste particularly salty. Cheese, cured meats, canned soup, bread, condiments, frozen meals. A single serving of many commercial cheeses contains 300 to 500 milligrams of sodium. 1 can of soup can contain nearly a full day's recommended intake in a single bowl. Your body holds approximately 4 cups of water for every gram of excess sodium. That retained water goes directly into your tissues, and your already sluggish lymphatic system has to work harder to clear it. A practical rule: if a packaged food contains more than 400 milligrams of sodium per serving, treat it as an occasional food, not a daily staple. The second is sitting after dinner. The hours between 7 and 10 in the evening, the hours when you finally relax, are the hours when your legs pull in the most fluid. 3 hours of near-complete stillness after your largest meal creates the worst possible conditions for overnight drainage. The lymph belt stops entirely, the reservoir fills, and then when you lie down, all that fluid shifts back into your bloodstream, your kidneys go into overdrive, and you wake up at 2 in the morning wondering why your body won't let you sleep. The third is evening alcohol. Even a single glass of wine does 3 things that directly worsen lymphatic swelling. It dilates your capillaries, increasing the rate at which fluid leaks from blood vessels into surrounding tissue. It suppresses the hormone that tells your kidneys to slow down fluid production at night. And it reduces sleep quality, which reduces the gentle overnight movement that normally contributes to lymph drainage. 1 drink in the evening, and your ankles will be measurably worse by morning. Now let's talk about what you can add, because what you eat directly affects how freely your lymph flows through those aging vessels. Water first, and I need to address the counterintuitive thinking here. Many people with swollen ankles drink less water because they believe more fluid in means more fluid pooled in their legs. The opposite is true. Dehydration thickens lymph fluid, making it sluggish and slow-moving. A well-hydrated body has thin, free-flowing lymph. Your target is pale yellow urine throughout the day, not colorless, not dark amber. And taper your fluids after 5 in the afternoon, so you are not adding unnecessary overnight kidney demand. The second pillar is flavonoids, plant compounds found in dark berries, citrus peel, and red cabbage. These compounds support the structural integrity of lymphatic vessel walls and the small valves inside them. Think of them the way you think of calcium for bones, structural maintenance over weeks and months, not an overnight fix. Around 40 to 50 grams of dark berries daily is enough to provide meaningful support. Frozen works just as well as fresh. Third is protein. Many older adults are mildly protein deficient without knowing it. A protein in your blood called albumin creates the osmotic force that pulls fluid from your tissues back into your capillaries. When albumin falls too low, that force weakens and fluid leaks into tissue with no return mechanism. No amount of leg elevation fully compensates for insufficient protein. Eggs, fish, legumes, cottage cheese, a meaningful source at every meal, not just dinner. And fourth is magnesium, which supports smooth muscle tone in lymph vessel walls and is deficient in the majority of people over 60. Pumpkin seeds, dark leafy greens, and almonds are the simplest food sources. It's one of the quietest contributors to lymphatic sluggishness and one of the most straightforward to address. This is the core of everything. The timing matters, the sequence matters. Follow it exactly. Morning. Before your feet touch the floor, while you are still lying in bed, do 30 ankle pumps. Pull your toes towards your shins as far as they will go, then point them away. Flex and point 30 times. This takes 45 seconds. Here is why this matters. While you sleep, you are horizontal. Gravity is not pulling fluid down into your legs, and your lymph system has spent the night slowly clearing the reservoir from the day before. The moment you stand up, gravity immediately begins pulling fluid back down. Within 20 minutes of standing, you are already rebuilding the problem you spent all night reducing. 30 ankle pumps before you stand restarts the lymph belt while gravity is still on your side. Then drink a full glass of warm water before anything else. Warm, not cold. Warm water rehydrates your lymph fluid and gets it moving before your vertical day begins. Daytime, every 45 to 60 minutes. Every 45 to 60 minutes of sitting, you need a brief reset. Standing, 20 calf raises, rise up onto the balls of your feet, lower slowly 20 times. Seated, 20 foot pumps, the same flex and point motion from your morning routine. Or simply stand and walk around the room for 60 seconds. Set a phone timer if you need to. Within 2 weeks, you won't need it. You'll feel the heaviness beginning to build in your ankles, and that sensation will prompt you to move before you even consciously think about it. Before dinner, 5 minutes of walking, not a workout, simply 5 minutes of easy walking before your evening meal, around the block, around the house. This activates the deep calf muscles in a way that seated pumps cannot replicate, and it primes the system before the long evening sitting period. Evening, 90 minutes after your last meal. This is the most powerful step in the protocol, and the timing is critical. 90 minutes after eating, not immediately after. Here is why. Digestion requires significant blood flow to your gut. The lymph vessels in your abdomen are actively processing the fats from your meal. If you attempt leg elevation and deep breathing immediately after eating, you are competing directly with your body's current priority. You will get far less benefit, and some people experience genuine discomfort. 90 minutes. That is the timing that makes this work. Find a wall. Lie on your back with your bottom as close to the wall as comfortable. Legs straight up, heels resting against the wall, at roughly a 90-degree angle to your body. If you're not flexible enough for a true right angle, 60 or 70 degrees still works well. The goal is heels above hips, hips above heart. Stay there for 15 minutes. Within the first few minutes, you will feel the change. The heavy, pressurized feeling in your ankles begins to ease. That is gravity-assisted lymphatic drainage working in real time. Fluid moving away from your ankles toward the lymph nodes in your groin, where it can be processed and cleared. While you are in this position, breathe from your belly, one hand on your abdomen. When you inhale, your belly rises. When you exhale, it falls. Your chest barely moves. Here is why this matters more than almost anything else in this entire protocol. Your thoracic duct, the primary drainage vessel of your entire lymphatic system, passes directly through your diaphragm. Every deep belly breath contracts the diaphragm and creates a pressure difference that actively draws lymph fluid upward through that duct, like a bellows pulling fluid toward your chest. Every single breath is literally pumping your lymphs. Most people over 60 breathe shallowly from the chest for the majority of the day. That shallow breathing is one of the most underappreciated contributors to chronic lower leg swelling, and one of the easiest things to change. Breathe in for 4 counts, breathe out for 6. The longer exhale matters. The thoracic duct draws most powerfully during exhalation as the diaphragm releases. In the final few minutes, add this. Place your hands flat on one calf just above the ankle. Using the flat of your fingers, stroke the skin slowly and firmly upward, from ankle toward knee, 10 strokes on each leg. Always upward, always toward the heart, never downward. You are not working out a muscle knot. You are gently guiding fluid through the lymph vessels toward the nodes. Long, slow upward strokes. When you finish and sit back up, you will almost certainly need to urinate. Go immediately. What you produce, 300 to 400 milliliters of pale urine, is the fluid that would otherwise have shifted into your bloodstream at midnight and woken you up. You just drained it while you were awake, in 15 minutes of restful, deliberate movement. Now, here is what happened to Margaret after 3 weeks of this protocol. By the end of week 1, the groove where her socks had pressed into her calves each evening was gone by the following morning. By the end of week 2, she was sleeping through the night. The 2 a.m. trip to the bathroom, gone. The 4 a.m. trip, gone. She was waking up rested for the first time in years. By the end of week 3, her ankles at 9 in the evening were the same size they had been at 9 in the morning. She came back into my office and asked what had changed in her body. Her heart was unchanged. Her prescriptions were unchanged. What changed was that her lymphatic system was finally receiving the signals it had always been designed to respond to. She wore her old walking shoes again on day 18. Before you go, leave me 2 things in the comments. What time of day is your swelling at its worst? Morning, afternoon, or evening? And how old are you? I read every comment, and your answers shape every video I make on this channel. And if someone you love has been told for years that their swollen ankles are a heart problem, send them this video. They have almost certainly been given a treatment that reaches the wrong compartment. This may be the explanation nobody ever sat down and gave them. I'm Dr. Sarah Ellison. I'll see you in the next video.